If you have been prescribed metformin, you've probably heard about its side effects like nausea, bloating, diarrhea, and stomach cramps and the likes. Maybe you're even experiencing them right now. But the truth is, most people don't know that these side effects can be avoided or reduced. Diabetes can be stressful to deal with for some people, and the last thing you want is regular visits to the toilet added to this stress. Hello, my name is Pelumi E. I am a specialist nurse in the field of diabetes, and if you're new here, this is the Diabetes Specialist Network, and here we discuss everything within the subject of diabetes. If that is of interest to you, quickly subscribe to this channel and give this video a like for YouTube to suggest to more people like you. So in this video, I am going to give you a full guide on how to take metformin, following 4 proven strategies that can eliminate or dramatically reduce those stomach issues. I have a video where I completely broke down how metformin works in a very simple way you can understand. You might want to watch it after this video. Some people take this metformin absolutely feeling alright, while for others, nausea, vomiting, or stomach cramps won't let them continue after a few days. I really want you to know that these side effects can be normal in the first couple of days, but before we go into how to reduce or avoid them, let's discuss briefly why and how they happen. Metformin pulls sugar into your intestine, which drags water along with it and therefore loosening up your stools. It can throw off the delicate balance of trillions of bacteria in your intestine, causing fermentation and then leading to bloating, cramping, and diarrhea. Metformin also prevents the reabsorption of bile acid, causing a lot of it to remain in your intestine, and then the body sends loads of water to dilute this bile acid, which then results into loose stools. Now, let's get into the most important part, how to take metformin. 1. Always take metformin with food. This here is very important. When you take it with a meal, say for instance your breakfast, it acts as a buffer. It slows down the absorption of the medication and prevents a high amount of the medication from being absorbed quickly, which can trigger nausea and vomiting. 2. Increase your dose gradually. Metformin is not a quick fix to regulating high blood sugar. If your blood sugar and A1C has been high for a long period of time, healthcare professionals will normally prescribe what we call a rescue therapy, and this includes medications like gliclazide or insulin to quickly lower your blood sugar and prevent complications and also relieve those symptoms of hyperglycemia. Metformin is not included among the class of rescue therapies, and this is where many people get it wrong. They start at a very high dose too quickly and their body just can't handle it. The standard approach should be starting with 500 milligrams once a day, usually with your evening meal. And then after about 1 to 2 weeks, depending on how you tolerate, you can then increase to the 500 milligrams twice daily. From there, you can gradually work your way up to the maximum daily dose, which is the 1 gram twice daily. But make sure this is done under the supervision and guidance of your healthcare professionals. This gradual titration gives your digestive system time to adapt with this medication. But I need you to bear in mind that there is no rush. Your doctors should be guiding you anyway on this process. But if they've started you already on a high dose right away and you're struggling, it's absolutely okay to ask them to step down the dose and then increase it gradually. Just let your healthcare professionals make this call. 3. It is advised that you limit the amount of fat in your food when taking metformin. Food like high fatty meat, fried food, very cheesy meals like, your cheesy burgers, oily takeaways, or that stew that is covered with lots of palm oil. All of these things can slightly worsen metformin side effects. From another perspective, if you are type 2 diabetes, you should not be taking very fatty foods anyway. And this is solely because type 2 diabetes is often part of what we call cardiometabolic syndrome, of which dyslipidemia is a member. Now, dyslipidemia simply means deranged cholesterol levels, which can increase the risk of heart problems. So it's a win-win for you to reduce your fat intake, actually. You don't need to cut off your fats completely because it's still an important food component. Just be strategic. When you are taking your metformin, pair it up with lighter, balanced meal containing good unsaturated fat. 4. Ask your doctors about the extended release formulation. There are 2 main versions of metformin, We have the immediate release and the extended release, which is also sometimes called the modified release or the slow release metformin. The immediate release version dumps the full dose into your system relatively quicker. The extended release version releases the medication slowly over several hours. Studies has it that the extended release metformin reduced side effects by about 20 to 50% compared to the standard release, and that's very significant. The only concern about the modified release is that it can be a bit pricey for those who are having to pay for their medications. But if you have followed all the previous 3 steps and you still can't tolerate, I think it's really worth trying to pay for the modified release just before you give up on this medication. If you have tried all these strategies I mentioned and you still can't tolerate metformin, first, I need you to know that you're not alone and there's absolutely nothing wrong with you. But I need you to speak with your healthcare professionals as there are several other medications for the treatment of diabetes which can be explored. I am sure you found this video very insightful. Watch my next video on the 7 truths I badly want to tell you about metformin.